Tool was originally created and used in Thames Valley and Wessex. It's been successfully implemented in many regions since. Adaptations have been made with the unique nature of our region in mind and following feedback from stakeholders within our network, including members of the Critical Care Working Group, critical care leads in district general hospitals, and from South Thames Retrieval Service. The main goals of the STOPP Tool are to provide paediatric teams with a process to follow that will improve the safety of all inpatient children and young people requiring transport, to enhance the objective approach to transfer and enrich the subjective assessment while reducing the potential risk for error from human factors, and to standardise documentation, improve clinician familiarity and audit transfers to gain enhanced insight into the patient movement around the region. The STOPP Tool can be used for any paediatric inpatient that requires transfer. The range of patients that most benefit from the tool are those previously described as high dependency and now referred to as level 1 or level 2 critical care. This is because the tool adds an element of safety, and these children are a high-risk group. In theory, it's nice to imagine that there are specific patient groups that are transferred by South Thames Retrieval Service, and everyone else is transferred by their local team. However, the reality is that there is a very grey area where the patient assessment and decision-making process can be challenging. If the wrong choices are made, then the patient can be put at risk. The STOPP Tool is particularly helpful in managing this bracket of patients. The other group of patients that pose a particular challenge are those classified as time critical. These should be transferred by their local team with advice from South Thames Retrieval Service. The STOPP Tool can be used to guide safe and timely transfer for this group of patients. Whether time critical, ward level, or level 1 or 2 critical care, the most important aspect of the STOPP Tool is about improving safety of patient transfer. Use of this tool can be prompted and commenced by any member of the clinical team, but the best use of the tool is as a team approach to perform the checks and create a sound plan of action. At minimum, there should be a qualified nurse and a paediatric doctor involved in the process.
We will now talk you through the pages of the STOPP Tool and how to use it. It would be useful to have a copy of the document in front of you as we talk through the pages. Please note that this tool is for guidance only, and it is important that clinical judgment by senior clinicians is always used. Page 1. Page 1 includes essential information about the patient which will be needed by the receiving hospital, starting with basic details and moving on to clinical details and the reason for transfer. There is space here to document any allergies, infection control information, and safeguarding concerns. You should also document the details of the referring and receiving teams. The risk assessment results section at the bottom of the page is completed after undertaking the risk assessments on pages 2 and 3. A key part of the document is the patient risk assessment on page 2. Complete the A2E assessment of the child's current clinical condition using this checklist. Be sure to document your clinical observations on the left-hand side of the checklist. This will identify any triggers which would indicate that the transfer requires additional consideration. Please note that not all triggers are designed to highlight the same thing, but all result in team situational awareness. If the answer is yes to any of the trigger questions, the following actions must be taken. Treat the immediate concern and work to stabilise the patient. If the transfer is happening due to capacity, consider stopping the transfer and transferring an alternative patient. If the transfer must go ahead, complete the transfer risk assessment on page 3. Inform the paediatric consultant of the triggers, the plan, and the transfer team choice. If indicated, contact the South Thames Retrieval Service, STRS, for advice before proceeding. There is space at the bottom of page 2 to document details of the clinical plan and the name of the consultant doctor informed. There is space on this form to complete this risk assessment twice. The second assessment should be used for any patient who triggers on the first assessment and for reassessment prior to transfer when transfer is delayed. The final assessment should be completed as close to the actual transfer time as possible, ideally within 30 minutes of transfer. Page 3. The transfer risk assessment at the top of page 3 provides a guide for who should accompany a child based on these 3 factors: the transfer category, the presence of any triggers identified in the risk assessment, and whether or not the transfer is time critical. The risk assessment also advises whether or not to call STRS to discuss the transfer. Following completion of this risk assessment, go back to the bottom of page 1 to document the recommendations. At the bottom of page 3, there is encouragement to stop, communicate, and equip. Identify key personnel involved in the transfer. Ensure that the destination hospital has been identified and bed availability confirmed. Document discussion with the family and the identity of the parent or carer who will accompany the child. Finally, there is a list of equipment to be considered for the transfer. Page 4. At the top of page 4, there are further prompts to stop to plan ahead. There is space here to document the ambulance transfer details, including the time the ambulance was called and the time of arrival at the referring hospital. You are prompted to answer the following questions. How will the transfer team get back from their destination? Do they have access to important personal items such as a mobile phone, money, or cash cards? Are there any patient-specific instructions for the transfer, such as monitoring, maintenance fluids, or IV access? The patient should be given 2 ID bracelets prior to transfer. Finally, there is a checklist for paperwork needed for transfer. This includes a local observation or PEWS chart to be used by nursing and medical staff during transfer. It is important that this is a local document for transferring team, as familiarity enhances safety. The bottom of page 4 gives space for clinical notes to be written about the transfer as you stop, monitor, and document. This may include patient assessment, interventions on transfer, and a summary of the transfer, including any adverse events. When you arrive at your destination, 3 copies of the STOPP Tool should be made. 1 stays with the receiving hospital, 1 goes in the notes at the referring hospital, and the final form should go to the transfer lead at the referring hospital for auditing and monitoring purposes. We hope you have found this video useful for using the STOPP Tool in your area. For further advice, please speak to your local education team or senior clinicians. The tool is reviewed periodically, so if you have any advice about improvements, please email stpn